welcome to this week's edition of Health Insurance Today on radio, on Lagos Traffic Radio 96.1 FM, the show that educates and brings you the latest information on everything health insurance. This program is brought to you by A-Star Communications Limited. Asking you, what are medications, by the way? Is there any difference between drugs and medication?
Yes, thank you very much for that question. I want to say that drugs are anything as it were that can alter your physiological functioning. If it can alter it, impair it or improve it, it's more or less their substances. Whereas we can say all medications contain drug substances, we cannot say all drugs are medications. And that's why I should, at the very beginning like this, I should say there is a difference between drugs meant for medication use and drugs that we call hard drugs.
Okay.
So that's why the World Health Organization have informed us, have told us we should be using the term medicines when it comes to like day-to-day uses of drug medicaments.
Fantastic. So
Yes.
in nutshell, we can say that all medications are drugs, but not all drugs are medication. Well said. But these days, we see almost everybody in the streets, in the community, handling or trading drugs and medications. We should really be responsible for proper handling and management of medications.
Thank you very much for that. Now, for the management of drugs and handling, as you have mentioned, the pharmacist that has been trained is the person at the center of drug management, drug distribution, drug dispensing, as it were, to patients, to end user, to consumers. The pharmacist at the core. But when we talk about regulations, we have bodies, corporate, government agencies that are responsible for regulating the practice, the drug products, the manufacturing, the production, the sale, the marketing. Like we have the Pharmacy Council of Nigeria that has been established with the Act 31 of 2022. That act was newly introduced about 3 years ago. That body, the Pharmacy Council, regulates pharmacy practice in all its ramifications. And we have another agency, the National Agency for Drug and Food Administration. That is NAFDAC, popularly called NAFDAC. They are responsible for regulating the importation, manufacturing of drug products. And we have a third one. I mentioned hard drugs. Because of hard drugs, the illicit use of drugs, we have the NDLEA, National Drug Agency, not NAFDAC now, NDLEA, that's responsible for monitoring, for overseeing illicit use of drug products, especially controlled products and what we call psychotropic products.
All right. Joining us, how can we eliminate or reduce the menace of fake drugs, which puts people's health and lives at risk? And how can people identify fake or expired drugs also?
I mentioned already to you the agencies, the government agencies that are supposed to be regulating pharmacy practice, drug products. I mentioned Pharmacy Council of Nigeria, which is responsible for the practice, the personnel, and the premises where drugs are sold. I also mentioned NAFDAC, that is responsible for the drug products, the quality and the safety of the drug products. NAFDAC is responsible. But I must quickly tell us about a particular guidelines that was introduced, that was signed into law since 2012. That was during the regime of former President Obasanjo. The National Drug Distribution Guideline was meant to streamline her distribution activities as it relates to medicine, drug use, the distribution of drug, the dispensing of drug, and all that. Unfortunately, up to this time we are talking about, we have not been able to fully implement. We've not even done much about the implementation of that National Drug Distribution Guideline. It was something put together to help us so that the chaotic situation we have in our country regarding drug distribution and drug getting to the hands of people it shouldn't get to will have been addressed.